Hi, everyone. My name is Rachel Eckenreiter, and I am the Quality Improvement and Accreditation Coordinator for the New Bedford Health Department. I am very excited to present to you the key findings of our 2022-2023 New Bedford Community Health Assessment. During this presentation, we will go over the vision and methods for this assessment, as well as the 7 key health themes that arose when reviewing the assessment's findings. During the peak of the COVID-19 pandemic, light was shed on the disparities many of our residents routinely face in healthcare access, housing, economic stability, and food access. It also shed light on the gaps in partnerships and collaboration needed to address these disparities. It was during this time of great need and innovation that long-awaited partnerships were formed. One of these partnerships was between the New Bedford Health Department and South Coast Health. Beginning in 2022, the New Bedford Health Department and South Coast Health began discussing the possibility of collaborating on a community health assessment. This collaboration would support the creation of a health assessment that combined clinical and population health. In addition, this partnership would extend the reach of community feedback and data collection. Together, they developed a document that used data to highlight community needs across the social determinants of health, while also including assets to build the community up and activate community partners into planning toward the future of a healthier city. When planning this assessment, it was important that all data collected and reviewed incorporated a health equity lens and was guided by a social determinants of health framework. Social determinants of health are non-medical factors that influence health outcomes. They include the conditions in which people are born, grow, work, live, and age. Some of the quantitative methods utilized in this assessment included a socioeconomic and demographic profile of New Bedford, which includes data from the U.S. Census and the Department of Elementary and Secondary Education. This also included a review of available health data from the Center for Disease Control and Prevention, the Mass Department of Public Health, and the New Bedford Health Department. The qualitative data collected included 19 key informer interviews with community leaders and input from the Greater New Bedford Health Equity Community of Practice and the Healthy New Bedford Partnership meetings. To gain a deeper understanding of the capacity of city government and organizations to address city needs, an audit of community assets was conducted. A health and social service provider survey was developed and distributed to service providers across the city. 200 surveys were completed. A majority of these were completed by nonprofit organizations or social service agencies and healthcare providers. The figure to the right of the screen shows the population groups served by the health and social service providers that completed the survey. Among these are mental health providers, youth and family serving organizations, and service providers for the unstably housed. A triumph of this assessment was the large sample size collected while utilizing our community survey. 1,018 survey responses were collected. The successful data collection was thanks in large part to efforts of community health and outreach workers. Through common language, culture, and trust, these professionals were able to collect community feedback from groups whose voices are historically missing from similar assessments. Due to this tireless work, 73.9% of community respondents identified as Hispanic, and 67% of respondents identified as women. A majority of respondents were under the age of 35 years old. 66% of respondents reported having a median household income under $25,000. 79.5% reported that they primarily speak a language other than English. 80.9% of these respondents spoke Spanish. To begin this assessment, we will first discuss the demographic makeup of the community we serve. According to the 2020 census, New Bedford's population is 101,079. Our median age is 36.4, which is slightly younger than the state overall. When examining the figure at the top of the slide displaying the racial makeup of New Bedford compared to the state as a whole, it is important to note that the city's non-white population is larger compared to the state, with a majority of this coming from the other race and two or more races categories. The figure on the left of this slide displays the city's non-white population change between 2010 and 2020 compared to the state overall. After reviewing the figure on the previous slide, it is not surprising to find New Bedford's non-white population growth was roughly 5% higher than the state overall. In 2020, New Bedford's foreign-born share of the population was 19%. The city's rich history as a gateway city for new arrivals to the United States seems to be the most likely explanation for these statistics. New Bedford's fishing industry has brought diversity, innovation, and talent into our city for over a century. Historically, immigrant populations such as the Portuguese and Cape Verdeans have cultivated deep roots in our city's tapestry. A new addition to the city's cultural fabric includes the Hispanic population, a group made up of a large amount of cultural and national origins. As of 2020, New Bedford's Hispanic population was 24.3% of the city's total population. When examining Department of Elementary and Secondary Education reporting on race and ethnic demographics of New Bedford public school students, Hispanic students make up 42.5% of the total student population, which could serve as an indicator of how the Hispanic population in New Bedford could continue to grow in the future. As we move into the presentation of the key health themes of our assessment, the format of our presentation will begin with the findings within each key health theme. The section for each key health theme will conclude with a review of some community assets and activators that could serve as launch points for health outcome improvement. The key health themes of the 2022-2023 New Bedford Community Health Assessment include economic opportunity, mental health, substance misuse, housing, nutrition and food access, chronic disease, and health access. There are subcategories within each theme that may be explained further in their corresponding key health theme sections. Key Health Theme 1, Economic Opportunity. Economic opportunity is defined as the ability of an individual to reach their personal potential. Economic opportunity includes having access to resources that are essential to maintaining a good quality of life, such as education, attainable housing, healthy food options, childcare, and stable employment. In regards to economic opportunity and overall health in New Bedford, a community leader said, "We need a holistic approach to all dimensions of health and wellness within our region, including reconnecting marginalized groups with the resources that can improve their economic outlook, especially in terms of education." To further understand the economic opportunity in New Bedford, we will explore the city's economic profile. New Bedford's median household income is 57% of the statewide median. 18.6% of New Bedford's individuals and 15.1% of its families are living below the federal poverty level. When examining the figure to the right, it is clear that these percentages are nearly double the state percentages. The struggle of these residents was further exacerbated by the 2022 inflation. In regard to this, one survey respondent noted, New Bedford has many people that are on fixed incomes, so they are much more vulnerable when prices rise. Economic opportunity and education are persistently linked. College education is one of the most effective ways an individual can improve their economic outlook. Statistically, children of parents in lower income brackets are less likely to pursue a college education in comparison to their more affluent peers, and when attending college, they are even less likely to graduate. Likewise, parents with less education increasingly face more barriers economically than their more educated counterparts. In 2022, high school graduation rates in New Bedford were 75.1%, falling short of the statewide average by roughly 15%. When reviewing the Census American Community Survey 5-year estimates between 2016 and 2020 on individuals 25 years and older with at least an associate's degree, New Bedford falls short of the state average by over 25%. On the connection between education and social mobility, this is what one stakeholder had to say. Rising out of poverty is nearly impossible without education or training. The key is, how do we make that happen? The future of our region depends on finding new ways to connect disengaged residents to these resources. The city has many assets and community activators that work to improve economic opportunities for residents. A couple that we would like to highlight at this time can be categorized under education. Bristol Community College's National Offshore Wind Institute offers training and certification for the offshore wind industry. In addition, Bristol Community College is partnering with the New Bedford Public School District and UMass Dartmouth in the Massachusetts Early College Initiative. This program provides pathways for early college attainment for students who are traditionally underrepresented in higher education. This program is currently offered in the academic areas of business administration, health sciences, information technology, and the arts. To further bolster and support a love of learning at an early age, the New Bedford Public Schools District, in collaboration with the Commonwealth Preschool Partnership Initiative and local education partners, have extended the preschool program by 10 public preschools offering full-day service. The full-day service has increased participation in early childhood education in the city. Key health theme 2, behavioral health. According to the 2019 CDC Places Project, 19.3% of residents reported having more than 14 days per year with poor mental health. This estimation may be different when compared to today's post-pandemic environment. The 3 primary mental health factors identified by community members and providers during this health assessment were the shortage of mental health professionals, issues related to the behavioral health system, particularly the shortage of inpatient beds, and barriers to equity in mental health, including access and stigma. One community stakeholder noted, the ongoing shortage is a crisis. Patients in need of specialized inpatient care wait in hospital emergency departments for beds to open or do not seek help at all. Another noted a systemic issue with how mental health is covered or not covered by insurance, writing, insurance should cover mental health to the same degree as physical health. Cultural stigma related to mental health was found to be a prominent barrier to addressing mental health concerns for immigrant populations and some communities of color. One survey respondent noted, you just don't talk about mental health in some cultures. Lack of trust and fear among these groups were also common themes throughout the interviews, particularly among the immigrant community. These fears included the fear of addressing a mental health concern, the fear of doctor's visits, the fear that they will not be able to afford treatment, and the fear of navigating the healthcare system. As a result, many residents only visit a mental health professional when the condition worsens. This practice applies not only to mental health, but health conditions in general. One community leader commented, "There are issues with the cultural and linguistic competence of mental health providers across the region. There is simply not enough diversity among mental health professionals, both in mental health and healthcare as a whole." The community asset we will be highlighting in this key health theme is Child and Family Services Community Behavioral Health Center. This behavioral health center will serve as an entry point for urgent mental health and addiction treatment for people of all ages. The center will offer community crisis stabilization, which is described as a less restrictive alternative to inpatient hospitalization for people in need of short-term overnight crisis care. Key Health Theme 3, Substance Misuse. 83% of respondents to the Health and Social Service Provider Survey rated substance use disorder as an extremely concerning health issue. In addition, health and social service providers increasingly report seeing patients with a dual diagnosis. That is, individuals who have been diagnosed with a substance use disorder along with a mental health disorder. They note the difficulty in treating patients effectively if these issues are not addressed simultaneously. A dual diagnosis often results from an individual with a mental health concern self-medicating with alcohol or drugs in an effort to improve their mental health symptoms. This could potentially be the cause of residents not being aware of available services and resources. Some community members reported a lack of awareness of what mental health services are available, where they are available, how to get a referral to treatment, and what insurance will or will not cover. In New Bedford, those with co-occurring mental and substance use disorder were nearly 3 times as likely to be readmitted for treatment. Another health concern that arose from the health assessment was the persisting opioid epidemic. The annual number of confirmed opioid-related deaths has been on the rise since 2015, with New Bedford reporting 80 confirmed opioid-related overdose deaths in 2022. Bear in mind that the period between 2015 and 2022 includes the COVID-19 pandemic and could have impacted this increase. 69% of health and social service provider survey respondents rated alcohol use disorder as extremely concerning, with one survey respondent noting, "Alcohol abuse is an issue that I feel we don't speak enough about. It affects more people than drugs." According to the 2019 CDC Places Project data, 17.4% of New Bedford adults reported binge drinking, falling slightly below the state average of 19.1%. One community leader said, "Alcohol abuse is a big issue in the Central American community, and getting support for treatment is difficult. They often don't know where to find services or don't recognize they have a problem." Alternatively, another survey respondent noted, "People know they are not healthy, and they avoid going to the doctors because they know they have issues, such as alcoholism. They don't want to hear what the doctor has to say, to be told they need to stop drinking. Speaking on the prevalence of smoking in New Bedford, one survey respondent wrote, "Cigarette addiction is a big problem for both our older and newer immigrant populations, and these habits are the cause of a lot of poor health outcomes." During the 2019 CDC Places project, self-reported smoking prevalence around New Bedford adults was 22.4%, compared to 12% statewide. The figure on the right side of the slide shows us that smoking prevalence varies among New Bedford census tracts, with higher rates in communities identified as vulnerable, in addition to having low household income. Nicotine vaping has become a progressively concerning health behavior among youth across the nation. When speaking to youth-serving organizations in New Bedford, this is a problem for our city's youth as well. According to the 2022 New Bedford Youth Health Survey, 22% of student respondents had used nicotine vape at least once in their lifetime. For this third key health theme, we will highlight two community assets. North Star Learning Center, in partnership with the New Bedford Police Department, has implemented an emergency room diversion program that increases resources for people in need of substance use disorder treatment. The New Bedford Health Department, with South Coast Health, has implemented a program that embeds full-time bilingual recovery coaches in the emergency departments of hospitals in Bristol County. This program supports people with substance use disorder navigate referrals to treatment and related services. Health Theme 4, Housing. The 2023 U.S. Department of Housing and Urban Development's point-in-time count identified 373 individuals, both sheltered and unsheltered. This number is consistent with the previous 2 years and is below the 14-year point-in-time count average. Despite the consistency in the point-in-time count averages for unhoused individuals, data and community voices suggest looming and long-standing challenges residents are facing in maintaining affordable and safe housing, which may be further upended by the ending of pandemic assistance programs. Two community leaders noted that some households are doubling or even tripling up with other family members or friends to ease the housing burden, while other households have no choice but to rent in less desirable areas. In the figure on the right of the slide, displaying the percentages of owner and renter-occupied housing, New Bedford is clearly a renter-occupied dominated city, with only 38.9% of housing supply being owner-occupied. During the 2016-2020 period, 46% of New Bedford's renters and 34% of homeowners were housing cost burdened, according to American Community Survey 5-year estimates. One key informant interview participant remarked, "Moving from fair market rents to market value rents means the landlords can demand higher rents while not having to deal with the red tape required for subsidized housing rentals." The figure on the left of the slide allows us to examine the disparities in housing equity across the city. Of particular relevance, more than 25% of Black and Hispanic residents are spending more than 50% of their income on housing. This is alarming when you consider that the recommended guidance is 30%. The asset we will be discussing in this fourth key theme is the Office of Housing and Community Development's Comprehensive Housing Plan, titled Building New Bedford: Strategies to Promote Attainable Housing for All in a Thriving New Bedford. With the goal of stimulating new housing development, reactivating underutilized properties, and relieving housing instability and affordability concerns. The plan also intends to allocate additional funds for rental assistance to help those at risk of homelessness to stay in their homes and to help rapidly rehouse those experiencing homelessness. Key Health Theme 5: Nutrition and Food Access. The U.S. Department of Agriculture defines food insecurity as a lack of consistent access to enough food for an active, healthy lifestyle. People who are food insecure are at an increased risk of a variety of negative health outcomes. Food insecurity often overlaps with many of the social determinants of health. 49% of Health and Social Service survey respondents rank food insecurity as the fourth most concerning health issue among the communities they serve. In New Bedford, 34,963 residents received SNAP benefits in July 2022. This includes an increase of 21.9% from February of 2020. This steep increase can be explained by the strain the pandemic caused on the economy. While food insecurity closely is linked to poverty, people above the poverty line can also experience food insecurity, which was especially evident during the pandemic. The SNAP gap is defined as the difference between the number of low-income Massachusetts residents receiving Mass Health who are likely SNAP eligible and the number of people receiving SNAP. It is estimated that 17,851 residents in New Bedford are potentially eligible for SNAP benefits but are not enrolled. The figure to the right of the slide displays the city's low-income census tracts, where a significant share of residents are more than a half mile from the nearest supermarket. Instead, these areas tend to have more convenience stores, which generally offer more expensive and unhealthy food options. This is further supported by stakeholder comments. One key informant interview participant said, "Many residents, particularly among the immigrant community, live in areas with no access to a supermarket, so they use local corner stores with less selection of healthy foods, with lack of fresh vegetables and fruits." Even with public transportation, one Health and Human Service provider survey respondent commented that taking 2 buses in the rain and handling heavy bags full of food is not feasible for most of our elderly clients. For this key health theme, we will be highlighting 2 community assets. Groundwork South Coast, with the New Bedford Department of Parks, Recreation, and Beaches, has implemented a program that supplies free garden beds for low-income populations in underserved parts of the city. The New Bedford Health Department's community health workers have completed training to offer support in SNAP benefit enrollment in multiple languages, adding to the list of organizations performing this service across the city in an effort to close the SNAP gap. Key Health Theme 6: Chronic Disease. Health conditions such as high blood pressure and high cholesterol stem from negative health-related behaviors and contribute to poor physical health. According to the 2019 CDC Places Project, 16.3% of New Bedford residents report experiencing more than 14 days per year of poor physical health in comparison to the state at 9.7%, while 33.2% of New Bedford residents report high blood pressure and 29.8% report high cholesterol. Higher disease prevalence can be linked to many of the health-related behaviors presented in the previous slides, including higher prevalence of smoking, lack of nutrition and exercise, as well as environmental factors. These disparities speak not only to the need for preventative care and treatment of chronic diseases, but also the need to address the social determinants that contribute to health inequities. As one community member noted, many people are supporting other households in their country, and they tend to overwork for this reason. They get sick but don't have the time to take care of themselves. On the figure to the right, 2019 CDC Places Project data on self-reported disease prevalence shows, among many other diseases, New Bedford's reported prevalence of both asthma and diabetes is higher than the state as a whole. According to the New Bedford Health Department 20-year mortality analysis, mortality rates in New Bedford have remained relatively stable over the past 20 years, with the exception of an increase in 2019 and 2020 due to the pandemic. Rates related to cancer and heart disease in New Bedford have declined since 2001, with heart disease dropping to the second leading cause of death between 2011 and 2015. Heart disease remains the leading cause of death for Black, non-Hispanic, and other non-Hispanic residents. Chronic liver disease is a cause of death that ranks among the top for Hispanic residents, but does not for white, Black, and other residents. There are a number of innovative assets and community activators working to prevent and treat chronic disease across the city. In this presentation, I will be highlighting two. New Bedford parks, recreation, and beaches have successfully created a number of beautiful green spaces for residents to be active in, continually contributing to the long-term goal of creating a more walkable city. This includes the construction of amenities in recent years, such as the Cove Walk and the Harbor Walk. There are also plans for extension of waterside walking and biking paths along the Acushnet River into the city's north end. Second, the YMCA is working to extend its diabetes prevention program through partnership with the New Bedford Health Department. This partnership will extend program reach and language capacity. Health Theme 7. Our final health theme is health access. Access to quality maternal and child health services and resources are paramount in the future health of New Bedford's families. According to the Massachusetts 2020 birth report, 79% of New Bedford's residents received adequate prenatal care. 11.8% of babies born to New Bedford residents in 2020 were born with low birth weight, which is defined as weighing under 2,500 grams. 9.4% of New Bedford residents were diagnosed with gestational diabetes. The top 3 obstacles to accessing healthcare, according to New Bedford residents that completed the community survey, were long wait times for appointments, lack of awareness of available services, and lack of evening and weekend hours. Regarding the lack of evening and weekend hours, one health and social service provider noted, "The work schedules of most of my clients don't allow them to visit the doctor during the day. They don't work the kinds of jobs where you can just take time off. If they take time off, they don't get paid." In addition, there were many open-ended comments related to a lack of knowledge of available services. Many suggested more materials are needed in Spanish. A survey responded noted that health access and health literacy go hand in hand. You can't access something if you don't know it exists. Transportation continues to be one of the top health access issues. Key informants note that many of their clients often can't get to appointments even when they have the desire to seek out preventative care or when they require treatment for various health conditions. An additional obstacle for members of new immigrant populations is fear related to their immigration status, leading to hesitancy when interacting with the health system. To wrap up our final key health theme, I will highlight two community assets that are striving to improve health access daily. The Sacred Birthing Village is an organization where sisters empower pregnant sisters. They are encouraging better birth outcomes by providing practical support during pregnancy and 1 year after birth. They provide workshops, events, and classes to explore options and enhance knowledge of additional resources for pregnant individuals and the village that supports them. The Southeast United Network of CHWs was formed in response to the disparities further revealed by the COVID-19 pandemic. This network includes CHWs from regional hospitals, health centers, health departments, and public health partners such as the YWCA and PACE. They meet regularly as a group to discuss regional progress as well as to share resources and best practices. To close, New Bedford has work to do to improve the health outcomes of our city in all the areas discussed. In sharing this space, I know we are ready to work collaboratively with the innovative and unique skills each of our organizations are bringing to the table. I am excited to get to work beside you. Thank you. If you have any questions regarding this presentation, please do not hesitate to reach out to me by calling our office at 508-991-6199 or through email at rachel.eckenreiter@newbedford-ma.gov.